Good morning. Since you can't be here in person, we made this video for you to give you some insight into our culture, our hospital, and our great city. We hope you enjoy it.
What are my 3 favorite things about Children's National Neurology?
That was a little tricky because I ended up with 5 or 6, but I decided to narrow them down to
people, number one.
Our number one, the people.
My colleagues. My coworkers. Many of whom I consider my very close friends.
the collaborative and friendly colleagues.
The camaraderie between all the staff.
Is the diversity of people and their backgrounds in terms of their specialties, their life stories, and what they all bring to the department.
We have a very diverse group of attendings, nurse practitioners, physician assistants, and other staff in our department.
All of whom really prioritize patient care and learning and advocacy for our patients. So
everyone's here to help children and help their families.
What do I like about my Children's National colleagues? They're smart, we like each other, and we're all willing to share.
Just the lack of drama within our department.
My colleagues. I love coming to work every day and working with the other attendings, the fellows, the nurses, the staff. Everybody makes this a great place to work.
I think part of the reason why so many of us who have trained in the program end up staying over time as well.
Number 2, the incredible opportunities available to us.
And advocacy opportunities.
The innovation we have lots of partnerships with institutions like NIH. We have a huge research institute at Children's National.
And this allows me the opportunity to be able to grow and develop new programs or therapies and to therefore feel like you're advancing medical care.
The department has a lot of flexibility for letting me and others work outside the United States, which is really helpful.
We also have many subspecialty clinics and departments within our own division.
The accessibility of our attendings is another one of my very favorite things because I have access via phone, email, in-person chat to really world expertise in neurology subspecialties.
So there's always an expert to ask a question to.
I know that I have such great collaborators in our neuroimmune group, our genetics, stroke,
Epilepsy or brain tumors, neurogenetics, neuromuscular disorders, neuro-ophthalmology.
Every little subspecialty in neurology is covered.
The third thing that I really particularly like is the enthusiasm of all of our trainees, our residents and fellows, and the opportunities I have to teach them.
From the first time I was on service, I was blown away by our fellows and our trainees and our residents, their enthusiasm, their desire to learn, their care and compassion for our patients on the neurology service, on consults. There was no case that was not interesting or that there couldn't be something that we could all learn about together as a team.
And the last thing is that I get to learn something new every day.
The level of mentorship that's provided from all of our great attendings.
The opportunity for a lot of one-on-one mentorship throughout every aspect of the program to really ensure that we can set you up for whatever career path you are destined for.
I really think the diversity of our patients, the diversity of our faculty, and the diversity of the disease here at Children's National just stands out as being extraordinary compared to anywhere else I've ever practiced. And so, diversity.
One of them is going to be the complexity of the cases that we see. We see some very interesting cases here, some of which you don't get to see in most other institutions where you may go. The other is the variety of cases. We get those complex cases, but we also get what we call the bread and butter cases, migraines and that sort of thing, since we are the primary care hospital for the Washington metropolitan region. And lastly,
because every day you are challenged by new things. In addition to that, you see people from many different cultures from all over the world speaking many different languages, different healthcare and cultural beliefs.
They're one of the top programs in the world, excellent by every measure. So we know that any questions we ask will be answered by the best.
It's really, from a clinical standpoint, the best place I've ever worked in the United States.